So this is me.
So Beth, do you want to talk about some of the potential programs for those who are deaf and have hearing loss?
Sure. So now we're going to get into some details about specific disabilities and specific services that you can be offering for people with disabilities. And again, going back to John's point, that not everything has to be done tomorrow or for every disability group immediately. So that's why I think when we talk about these ADA plans and we talk about things in terms of what you can do now versus what you can do in a year and 3 years and 5 years, that it's a process about, and so what we're going to be offering now is just some programs to be thinking about and to think about whether it is for now or for the future, about things that you might want to do to be inclusive of some specific disability groups. So for people who are deaf and or hard of hearing, there's a variety of services now that are out there. Hands-on, my organization, we do sign interpreted performances for deaf people who are culturally deaf who use American Sign Language as their mode of communication. So that's sign language interpreted performances. There is also open captioning, which if you actually look at the picture, it's on my right side. And that's where a captioner, actually that somebody is captioning this webinar, so that a performance is being captioned live in real time at the show. There is also, I have a little plug for GalaPro, which is a new app that was created by the Schubert organization that is an app that downloads onto a smartphone, where you will get real live captioning at a show, and deaf and hard of hearing people can sit anywhere in the theater, buy a ticket anywhere, go to see a show any date, any time, and get captioning at every performance. There's also a variety of assistive listening devices, assistive listening devices that people can get, including loop systems and infrared systems. So there's a variety of services. And it could be that a deaf or hard of hearing person wants to read a script. So it's a wide variety and a wide range of services that you can provide for people who are deaf and hard of hearing, and it could be from a script all the way through a sign-interpreted performance.
Mm-hmm. So in an organization's planning, in creating their ADA plan around programs and services for those who are deaf and with hearing loss, as we keep saying, this is something that's not going to be done overnight. So maybe in the first year, it's making sure that you have advanced copies of scripts available. That could be, that's your first, and you're going to research interpreters and open captioning services in your community. You're going to make sure that somebody on your advisory board represents the deaf community or has a hearing loss. So those could be some things that in your first year. In your second year, you might be offering one sign-interpreted experience. And then there'll be, of course, a marketing plan behind that. You're going to offer one captioning experience. And then you build upon it. It doesn't mean that you have to do, again, everything overnight. That's the purpose of the plan. But to then take the steps to actually move these services forward, and also understand as you're developing these services what the financial resources are going to be. Certainly some things, advanced copies of scripts, minimal financial resources. Having open captioning and sign interpretation, there will be a financial commitment to pay the interpreters as well as to pay the captioner. But you're going to, in that first year perhaps, is going to be researching the financial needs of these services. So you're going to use, maybe your first year in this is research, and then doing some of the things that have a minimal financial cost to them. In terms of assisted listening devices, I can tell you one thing that we do in New Jersey is at the New Jersey Theater Alliance, we purchase, I think we have probably 120 or so listening enhancement systems and transmitters that we share with cultural organizations. Some small cultural organizations have not had the resources to purchase their own equipment, so they borrow the equipment from the Theater Alliance. So that's something in your communities that you might want to give some thought to. In terms of looping, this is an area that you're going to hear a lot more about. Very difficult to loop pre-existing construction, a pre-existing building. You can loop a room for a lecture hall, but the looping is a magnetic field that enables individuals with a cochlear implant or have a hearing aid to hear very crystal clear. It's much sharper than a listening enhancement system, and you're going to learn a lot more about that technology as we move forward. And in fact, the New Jersey Theater Alliance, through a grant from our Cultural Trust, is going to be purchasing some boxed office mats that we're going to be sharing with our theaters so that individuals can actually, those mats which will have the coil embedded in them, so that individuals with hearing loss can actually have crystal clear communication when they are speaking with box office staff. So you're going to learn more about, as I said, more about this, about looping in the coming years as technology becomes more advanced.
And John, I just want to point out too, I know we're not the marketing webinar, but it's really important to understand that any kind of programs that we're talking about is a marketing program, and it's really to understand that we don't want to think about programs kind of separate from the communities that you're trying to serve. So every program that we're going to be talking about really has to be tied in with a marketing plan to get audiences. It's that kind of the old adage that if you build, if you put it there, they will come. They won't. And so every program that we're going to be talking about, and every accessibility service really that we're talking about, really has to be tied into community marketing and getting those communities to kind of take advantage of the programs that you're developing. So I just
That's right. And again, that's another reason why advisory boards are so important, and the individuals that you put on those boards, because they can really help you as you develop these programs and services, and really help you when you do offer these services to help spread the word about your organization and about the services being offered. So here there are some services for individuals who are blind and low vision. As I know many of you are familiar, of course, with Braille materials, not asked for as often as it used to be due to the advancements of technology. And also Braille is a very difficult language to learn, and the number one cause of blindness is diabetes, and you do lose sensation in your fingertips. So therefore, Braille is not for everyone, but once in a while it is requested, and there are organizations around. We have one in New Jersey that will do Braille programs. Just not the ads in playbills, but the specific information around a theater production or maybe an exhibit. They will provide that text in Braille. Large print programs, this is something that's definitely readily achievable to do. Large print is 14-point or greater, and many organizations do this on their copier machines. They might have 8 or a dozen materials on hand at all times for all performances and exhibits. So this way, if an individual does request it, it's always available, and it's not it's helpful to individuals and not a huge financial investment. And again, that is a service that's readily achievable. Seating, this is one area where, as I had mentioned in the example earlier about asking if you can accommodate an individual further, just to give thought to most individuals that are low vision do have some sight. and being able to perhaps sit in the first row or so can be helpful to individuals to be able to make out some shapes or some slivers of sight. So sometimes that will be a request, and it's important for organizations to be aware of that request. Sensory seminars, ghost and tours, museums have been offering tactile exhibits for years. Theaters now offer sensory seminars where props and costumes are being felt prior to a show. That's a readily achievable thing. It takes some staff time and some planning, but that is certainly an enhancement to the experience of somebody with low vision. And then you can go to the next step in terms of audio description. That would require somebody with some training, whether it's audio describing an art exhibit, audio describing a theater performance. There are many audio described trainers around the country that can provide the guidance in terms of providing an audio description. In the theater, it's really allowing individuals to know the entrances and exits of characters, sight gags, descriptions of props and costumes and scenery. And again, I know many organizations in their ADA plans, they just started with large print and a sensory seminar or docent tour. And that began to offer some services and began their connection with the community of individuals with low vision. So these are certainly, those are certainly some steps to begin. And then as the organization moves forward in their planning and, of course, in securing some additional financial resources, in later years in their planning, they begin to introduce the audio description.
And I think, too,
and museums have been doing a lot in the digital format arena as well. Mm-hmm.
Sorry. I think also one of the best things that can ultimately happen is if you start small and you start with, you know, a few small programs, is to have people from the community come back to you and ask that they want more. And that would be the best way to know that you're reaching the community and they like your organization and they like what you do and they want more. And that's the best way to kind of proceed, is to just know that you have people that want to come back and see more. So that's just a really good judge of knowing that you're on the right track.
Right. And always important to speak to your audience members when they've experienced a service, just to get the feedback so that services and programs can be tweaked and strengthened. So always engaging your constituents. And many organizations, as you all know, are beginning to offer a program for those individuals on the autism spectrum through sensory-friendly performances and cultural experiences. So we're seeing a lot more of this being added to organizations' ADA plans, again, where they're starting small. They are meeting with organizations that serve people on the spectrum, meeting with families, and just learning from them, as Beth said, having the conversation and asking questions, and then working together in creating a sensory-friendly cultural experience. And they might just offer one, but it took them several months of planning and discussions before they offered that one sensory-friendly experience. So, and then maybe the following year, they might add a second one. But they've continued their conversation and their feedback discussions with the constituency that is benefiting from this service.
And also take advantage of other organizations in your area that are already providing these services and visit them and kind of see what they're doing. And I mean, I think that programs for people with disabilities are, you know, they're burgeoning. They're new, and they're not that many that are going on. So I think it's good that we share information with each other as well to find out what other people are doing and seeing how we can work together to really increase the audiences.
So I do want to share with you that in 2017, we did a follow-up series of focus groups and surveys to evaluate the cultural participation among people with disabilities and seniors in New Jersey. It was a building cultural participation initiative. The first one was done in 2005 in our partnership with the State Arts Council, and in 2017 we wanted to see if anything had changed, and we want to give a shout out to the Kessler Foundation for helping us with that follow-up survey. And so we worked with a variety of partner organizations like our New Jersey Division of the Deaf and Hard of Hearing, our Commission for the Blind, county offices that serve people with disabilities, different patrons of our various cultural organizations that have disabilities. So we had a wide net of the survey, and then we had 6 focus groups where we were able to drill down and ask some more questions in greater detail that was facilitated by an outside consultant who assisted us in this project. So some of the key findings, and I think whether it's here in New Jersey or anywhere, I think these findings are going to be, we believe are probably going to be similar in other parts of the country. Individuals said that when they were looking for information on a website or over the phone about an accessible service, that it was very difficult to find. When they called an organization, in a lot of cases, the individual who answered the phone was not aware of an organization's access services. They sort of had to hunt and find somebody within the organization who could answer the individual's questions. Again, that just reiterates the importance of making access and this work an organizational priority, that everybody needs to be involved and be aware of what's being offered. And also they found the website to be extremely frustrating, and whether, regardless of the disability or regardless of the age of the individual, in these discussions, they all use the websites to find out what's going on. And they had a very difficult time with a lot of organizations who said that they were committed to accessibility, but they really had to do a deep dive in the website to find that information. So that was frustrating. Individuals with any disability, especially those with mobility impairments, found they were very concerned about attending a venue for the first time, not knowing if they were going to encounter any barriers when they arrived, what was public transportation like, restrooms, box office, etc. So that came up routinely. So again, important for information on websites or folks that are answering the phone, that they're very clear, and if there is a barrier, to let the individual know in advance so they know to expect it and not be surprised when they arrive. Accessible information often was, yeah, absolutely.
I'm sorry, John, I just want to throw out, only because I'm looking at this list, and I just really want to put out the word trust in here, because I think that what all these points really go to is that the person with a disability has to really trust that the information that they're going to be getting is accurate, and because not trusting the person on the phone, if you ask if your venue is accessible and the person halters or stammers or stops a little bit and going, I think so, or it should be, that means that a person with a disability might get there, and it could be a step which might mean nothing to a person who's kind of saying, well, it's almost accessible, but to a person who that step might be a mountain for is inaccessible. So I think it's this idea of, do you trust the person that is giving you the information that when you get to that venue, I'm going to be able to access all the things that I need in order for me to enjoy the situation. And so I think that word trust is really important in all areas. Even if the trust ends up being, we're not accessible, or right now we're not, or I can't do this. If I trust the information that's being imparted, then that just says like loads about your organization and about the person's ability to access the information. So I just want you to throw that out there.
Mm-hmm. And then just in lieu of time, just to kind of look at the other bullets, a lot of accessible information was very hard to find in different marketing materials on websites. Staff wasn't always informed. They would love a concierge, one-stop shopping so that they knew what various cultural accessible services were out there rather than having to hunt organization by organization, and of course some transportation challenges. So the importance of sharing this with you is that knowing this information, it goes back to, as you develop your ADA plan, it's really important that you have a clear understanding of the needs that the constituency you're looking to serve, what their needs are and what their challenges are, because that will help an organization better understand as they plan to move forward to serve that constituency, which is a good segue into the marketing and communication. Again, Beth, in lieu of time, we don't have to go through every bullet, but
right, and I think we've hit upon. Yeah, I think we've hit upon like most of these points. And the main point is for all these points, you have to get this information out to the disability community. They have to know about all this information.
Right, and in your ADA plan, there will be a marketing section. Again, what are the steps that you can take the first year in terms of marketing and communication to support your programming efforts? And then what is the marketing plan for the second year? So keeping in mind these various elements as you put your marketing plan together. And a big important piece of that marketing plan is going to be your organization's website. Again, we're not going to go through every bullet, but it's really important that the accessibility features of your organization are there. This accessibility statement that we mentioned earlier, the board-approved policy statement, have that available on your website. That lets people know that your organization is committed to this work. The seating diagrams to show where the wheelchair locations are in your organization. Ticketing policies, utilizing those access symbols. And again, as Beth said here, trusted, knowledgeable, and easy to find contact person. So if somebody does have a question, that there's somebody at the organization that's been identified that this individual can reach out to. And then these are some website resources. Important to have your website, that your website is accessible. So these are, it's important that it's accessible to everybody, regardless of a disability. So organization can check and look into guidance around website accessibility with these resources. And then you're going to be taking in your self-assessment. You're going to certainly walk through your facility and really think about what physical barriers there might be that need to be addressed in your auditorium in terms of wheelchair, or is making sure that you have enough companion seats for that are going to be seated with that patron that uses a wheelchair. Your restrooms, what steps are going to be encountered, and even taking a look at things like your parking lots and things, and your front entrance. Those are the things that you're going to walk through, and then from the assessment you'll see what specific areas need to be addressed, and then you can work that into your plan on how you're going to move forward in improving your facility to be more accessible. And these items here, bulleted here, are certainly some of the areas that you're going to take a look at when walking through and assessing your facility and planning future improvements. and that's the list continued. And I do have here produce a virtual tour. Just real quick, we did a partnership with Google, and they came in and they did a virtual tour for all of our theaters, from the parking lot to the entrance to the box office, lobby, restrooms, seating areas. So and this is up on theaters' websites. So this way, any individual, especially those that may not have been to the venue before, actually by going onto the website and seeing this virtual tour, it will really give them a good understanding of the layout of the organization before their visit. So going back to that apprehension of attending a venue for the first time, this virtual tour helps to relieve some of that uncomfortableness when attending a venue for the first time, that they can actually get a preview of what to expect before they arrive. And you can actually do that today on your, with the magic of our cell phones today. I know a lot of organizations have just used their phones to create a virtual tour. You don't necessarily need to work with Google. So emergency readiness, our organizations are definitely updating and developing emergency preparedness plans, and we want to make sure that when they do those emergency plans, that they're giving thought to their patrons with disabilities. And here are some resources that Beth and I found to be very helpful in emergency preparedness.
That would also go with your staff training, especially your ushers, when they get their training in general about how they deal in emergency situations with disabled patrons.
These are a couple more, Smart 9/11, which we think is great. And I'm sure many of you are familiar with these resources. So in terms, we encourage organizations to take a look at their strategic plan that they have in terms of their operations and programs, and follow something. The ADA plan is not dissimilar. It's going to have various sections, a section on policies, a section on programs, employment, marketing, facility, and then in each of those sections there's going to be goals that the organization hopes to achieve under that particular section. There's going to be action steps to achieve that goal. In what are those action steps in year 1, 2, and 3? Who's going to be responsible? What staff member? What board committee would be involved? What financial resources are going to be needed to achieve that goal? And when do they expect it to be done? Year 1, year 2, year 3. And to begin to outline that for each of these particular sections. Again, working together in different departments, working together on the appropriate sections, and having the plan then, when developed, having the board look at that plan, ask questions, discuss, and approve it. And then, of course, like with any plan, it's there as a roadmap. It's meant to be looked at, should be brought to staff meetings, maybe board meetings. Hopefully boards will have an access committee that can work with the staff and be the liaison to the advisory board that's developed, or at least one board member could be a liaison to the advisory board that the staff puts together, so that there's consistent board engagement in this effort, and that the plan is going to be assessed and reviewed perhaps annually, and then tweaked and updated. Just like your organization long-range plan, it's there to be helpful and to serve as a roadmap, and also to be assessed and updated when necessary so that it serves the current needs of the organization.
As well as your organization changes or things change that you know to adjust. It's a living document that's there to be adjusted.
And these are just some slides, snapshots of some sections of our website. So if you do go to the New Jersey Theater Alliance website and click on the Accessibility tab, we think our project resource library is extremely detailed. There's a lot of wonderful resources in there that we have pulled together from a variety of organizations. So we encourage our cultural community to utilize this when they're developing their ADA plan and moving forward in their access work. There's a lot of wonderful elements in this resource library. Another tab to click within the Accessibility tab is ADA planning. You'll see a lot of the sections about an ADA plan that we discussed this afternoon, and that will give you, there'll be some background, some instructions in there on how a cultural organization can develop and upload an ADA plan for the State Arts Council, which I'm very proud to say that New Jersey does require all grantees to submit a board-approved ADA plan in order to receive state funding. And so this area assists our organizations as they put together their ADA plan. And then this will provide, in here, you'll be able to see an outline of the plan that we share with our field, and that might be helpful to your community as well. And here is the contact information for Beth and I. We're very happy, of course, to answer questions in the time we have left this afternoon, but certainly if there's any other questions or thoughts that you have or need assistance as you move forward in educating your communities around ADA planning, we'd be happy to help you. So we'd love to hear from you.
Great. Thank you, John and Beth.
Yes.
Sorry, I didn't mean to interrupt.
No.
I was just going to mention one thing to the group. You guys just saw a whole bunch of really, really great resources, and what we're going to actually do, so just as an FYI to everyone, this call was actually recorded, so it will be available for you to go back and watch afterwards, but we're also going to create a tab that was on the event page where you registered with all of these resources that were included in the presentation. That way you can very easily find all of the resources that John and Beth just talked about. So now, as John said, we have some time to do questions with everybody. So again, just a quick reminder that if you have any questions to ask, feel free to type them into the chat box in the lower left-hand corner of your screen. Just to give folks a few minutes to kind of think about what questions they had, because that was a lot of really good content, and sometimes it just makes the brain spin. I have a couple of questions that I'll use to just kind of get things flowing in that sense. So there were a couple of things that really, really stood out to me. So one was the fact that you mentioned on multiple occasions the need to actually have somebody that's a member of the disability community as part of your planning process. So for those folks that might not already be in contact with someone that's a member of the disability community, how might you suggest going out or finding somebody like that? Who can they connect with?
Well, many organizations or many communities will have organizations that serve people with disabilities. So it might be a commission for the blind, or a commission for hearing loss or deafness. There's a lot of senior centers out there as well. And to keep in mind, a lot of a lot of the services that we talked about today will benefit older adults, though many older adults may not necessarily identify as somebody with a disability. It doesn't mean that they would not benefit or enjoy these services. And again, back to language, putting everybody under that disability umbrella may, if a senior saw something on a website that said services for people with disabilities, they may not look very far because they don't consider themselves somebody with a disability. But if you put it under the banner of, say, patron services, because that's really what a lot of this is, they would probably look a little bit further. And in your description, you can certainly say we provide a wide range of services for all of our patrons, older adults, people with disabilities, etc. But so it's important to work with those organizations that serve the senior population in your community as well, because they will benefit from a lot of the accessible services that you're looking to develop.
I think those are great. Sorry, go ahead,
Yeah,
Beth.
sorry. And I also think, too, is I know sometimes we get a little hesitant about kind of sharing resources, but I also think check in your communities, like other performing arts organizations that are doing accessibility, and find out what they're doing and if they would be, interested in kind of sharing information of some of their patrons or letting some of their patrons know about some other programs that you're interested in setting up, or that your theater is looking for some advisory members to help out. I know that we in the disability community, we share resources as well. So I know that I've recommended other friends of mine to other organizations that are interested in expanding their programs. So I think that it only does a service to the community to expand, and it shouldn't be looked at as I'm being protective of my group of people. So I think look at other organizations that are doing work in your communities as well.
And not necessarily arts. It doesn't always have to be arts organizations. There might be some other types of groups in your community. I had a lot of, when I started to develop many moons ago, advisory boards, I actually went to our local hospital, and they were really helpful in helping us identify some individuals. So you can even look to your healthcare providers in your local community to potentially identify some folks.
You can look at schools. I mean, try to think outside the box. I mean, think of outside, like what other organizations might, have impacted disabled people's experiences, and go there. So I think John's right about don't only think about arts organizations, but think about other areas that disabled people might congregate.
Mm-hmm.
Yeah, the other thing I really want to highlight that you had said was that, you're providing a service that benefits one group of people, but a lot of times it's something that actually benefits many groups of people. So I think about how many times I've been to a large conference where they've done live captioning directly on the screen of a keynote or something that's going on, and how many times that while I don't identify as a person that's hard of hearing, I'll find myself following along to the captions because I actually understand better when I'm consuming in both ways.
Right.
Well, and also you also never know. Sorry.
Yeah,
universal design. Yeah, but you also never know, like who knows a person with a disability. I mean, if we talk about 57 million people and more, everybody probably knows somebody who has a disability that you don't know about. So the idea of doing services, impacts like your entire audience, because you never know who might be able to go out and tell their friends that, they heard about these services that this organization is doing, and I know my neighbor or my cousin or my, or somebody that they've met that might benefit from those services.
Yeah, so I'm going to do one more quick plug. If anybody has any questions, again, feel free to type them in the chat box on the left-hand side of your screen. with that, I'm going to circle back around, though, to another question that came up for me that I'm wondering if either Beth or John, either one of you could maybe flesh out a little bit more. So you lightly touched on kind of the different phases of rolling out accessibility within your organizations. And I'm wondering if you could just touch a little bit more on organizations that are really working with limited dollars, where kind of the best place is for everybody to start.
I think the best place for people to start is in some of those items we mentioned at the top of the presentation. Those are readily achievable items. So a good place to begin is actually, we believe in accessibility and making sure that our environment is welcoming to all. Let's design a policy statement and get that approved by our board of directors. That's one. Two, let's take a look at our ticketing policy, the advanced notification policy. Let's start to form that advisory board. You can start an advisory board with, a handful of people. Let's get a board member from our organization to commit to serving as a liaison to that advisory board. I have found that to be the best where organizations actually have success in moving their ADA program plan forward is when there's always board involvement, at least one liaison to that advisory board. Let's take the time to do this self-assessment. So before we can actually put together a plan, let's take the next month or two to really go through this assessment, engage different elements of our organization so we know where we are in terms of access, but also, as I said, by going through that assessment, you'll also be able to see what's possible. And that could be your first 6 months in this work. That's your foundation right there before you actually begin to work on a plan, is just getting some of those elements in place. And we work with a lot of small organizations with very limited staff and resources, and this is where we suggest that they begin, before they actually even begin to sit down and write a plan, that they take these readily achievable steps within their first, and in many ADA plans, that's actually their very first year is all about assessment and policy development and advisory board development. That's all within their first year. They haven't really jumped full force into programming. They're just using their first year to gain knowledge and build a foundation.
And I just want to put out a little plug to the LEAD conference every year, which is sponsored by the Kennedy Center, and it's Leadership Exchange in the Arts and Disabilities. And it's really the only national, actually international conference for arts and disability and accessibility. And it's I think a place for anyone who is, whether you're just starting out on planning about accessibility or you have questions about accessibility, I think it's a good place to network with other organizations, both large and small, to talk to other people who are doing the exact same work that you're doing. So it's a place where I think people can go and not feel alone or not feel like out of their element in terms of asking the questions about accessibility, because that's what the conference is. And so it's every year. I think it's the beginning of August. I think this coming year it's in Denver. But it's a really great place for people to meet other organizations and other people and ask questions and see what other people are doing. So it's a great start, and so I would really encourage people to look into that.
I agree.
Great.
Maybe you can put that on your web. Maybe you could put that at the resources too.
Yes, absolutely. I'll pull the link to that conference to include on that. So great. We have no other questions. So and we're actually just about time. So we have perfect timing on all of that. So Just real quick, I want to again thank you both, Beth and John, for this wonderful presentation today, and thank you for everybody that attended today's webinar on accessibility planning. Just a reminder that, as I mentioned, this webinar was recorded and it will be available for replay. The replay will actually include live captions as well, and we will send out a notification to everyone that's registered, letting them know that the archive is available and ready for you to watch. So that's it for today. Thank you again, everyone.
Thank you.
Thank you, everybody. It was a pleasure. Thank you.